Is Dr. Jeffrey Curtis and his patient, Whitney White. They're teaming up with Creaky Joints, a national online patient community, to create revolutionary new programs called Arthritis Power being one. Thank you so much for being here.
Thanks very much for the invitation.
Of course. Tell me a little bit about Whitney. You are a patient. I know you've got a struggling voice right now, but you are an RA patient, is that correct?
That's
and also
correct.
a pharmacist and a mom.
That's right.
So, yeah, so tell me why this is an important cause for you.
Well, as a patient, it's really important for me to be able to partner with other patients to describe my illness and be able to contribute to data and research so that we can move research efforts forward to help patients, as well as myself, because I'm able to share the information on how the disease affects me on a daily basis with my physician.
Okay, and Dr. Whitney's obviously not the only one. A lot of people out there in our audience suffering from RA, rheumatoid arthritis, normal arthritis. Why is this important for you?
Much of my practice is focused on both RA and psoriasis and psoriatic arthritis, and I see patients several times a year, 4, 5, 6 times a year, but I don't see them the other 360 days of the year, and I want them to be able to have an effective means to both track their health and then communicate with me when I do see them in clinic what's been going on, rather than just the 5 or 6 times a year that I may see them.
So how does this partnership with Creaky Joints work? Tell me about it.
So Creaky Joints is the patient community, and it was started by a patient, Seth Ginsburg, who himself has arthritis. And he really started this patient community in 1999 to fill a need that he had, where he went to college and said, where are all the arthritis patients like me that need other resources, who have family members with arthritis? So he created this community to fill that need. In the last year, we've been very excited to receive a grant from PCORI. PCORI is the Patient-Centered Outcomes Research Institute, to create a new patient registry. It's research by patients for patients, to improve clinical care, as well as to answer questions that both patients and their doctors have about how to best treat arthritis and skin conditions like psoriasis.
And what applications are people finding, like Whitney and others, the most helpful?
So I think that from the perspective of patients wanting to know how they're doing and track how they're doing, sometimes we forget about what things were like a year or two ago. Remember, you were on this medicine before. In fact, it was this bad. You got better. We can do that again, to provide hope and encouragement, because sometimes it's hard to recall what things were like in the past, and to say, is my disease severe? Is it mild? How am I doing compared to others? How might I be able to do in the future, depending on what treatment I'm on? Those are important kinds of questions I hear all the time, and we've had very limited opportunities to answer those kinds of questions in the past until now.
Very nice. And Whitney, in closing, for the people out there watching that are in your boat, know somebody in your situation, how can they help? How can they get involved and learn about what you guys are doing?
Sure. Well, I would recommend that folks sign up for Creaky Joints to become a member. It's a free online community, as Dr. Curtis mentioned, where you have resources and support from other patients. And then additionally, enrolling in Arthritis Power, which is the application that allows you to assess how you're doing on a regular basis, track your outcomes, and communicate that to your physician.
Okay, and it's on your screen right now, creakyjoints.org for more information. Tons of resources and links there to help you if you are suffering with RA or arthritis. And of course, you guys are here local, so I'm sure they can reach out to you as well.
Indeed.
Yes. Thank you both so much for being here.
Thank you.
Thank you so much.
Of course. We've got to now send it over to the kitchen.